Hello, everybody. Welcome back to the PTC podcast. I'm here with Dr. Abdul Salam Al Belushi.
You got it.
Okay. I'm glad I got that right. I tried practicing and I still didn't get it perfect. But so welcome. Thank you for joining us. I know you're over from Texas. You got a busy week in Dubai. We were recommended by a mutual friend who said you're the foremost expert in stem cells and spinal surgery, and you're one of the top Emirati surgeons. So I really appreciate you taking your time to come here. What brings you to Dubai at the moment?
I've had several interviews with media outlets, Dubai, Abu Dhabi, Sharjah, and another emirate I'm not going to name, but I haven't responded to that request because I just don't have the time to and the bandwidth to be available everywhere. But and there was a recent article or a video posted by the Interior Ministry about my accomplishments, which kind of went viral, and so they wanted my presence to kind of highlight the accomplishment of an Emirati physician, one of only 10 Emiratis who has gotten their medical degree from the U.S., and the only Emirati who is American board certified in the field of neurosurgery.
I mean, that's very impressive. You're based in Texas?
Yes, Dallas, Texas, North Dallas.
What's Texas like?
It's hot, but not quite as hot as
Oh, really? Yeah, because I do hear
Dubai.
people complain about Texas heat.
Yeah, but it's an awesome country. I'll call it a country because the folks in Texas, they think they have their own country outside of the U.S., but it's a great state. We're very free and lots of good things happening there. But I think UAE is way better.
Mm-hmm. Yeah. So do you have any plans in the future to return home? And
Absolutely. This is my home, and I want to come back. I'm involved in a lot of projects there. I'm the chairman of neurosurgery in one of the prominent hospitals there. I am also partnering up with a stem cell center that is going to have a contract with Department of Defense on an FDA trial basis. I have a medical aesthetics practice there, and I have ownership in several medical facilities. And I'm also a chief health innovation officer for one of the premier STEM academy, where kids between the ages of 6 and 18 are involved in innovation and generation of patents, so they have a head start in getting into prominent institutions like Harvard, Princeton, Yale, you name it.
And just rewind the clock all the way back to when you were growing up in the UAE. Did you always want to go this direction? Is this something that you had your North Star and your aim in that way, or did you just kind of...
Bizarre story. Couple things happened. One, I think I was undiagnosed ADHD probably, and I might have an element of perhaps Asperger's, which is a spectrum of autism. Growing up, I could get things done very quickly. It didn't take me much time, and my parents were not educated, and so my father would always come and tell me, "Son, go do your homework." I'm like, "Dad, I'm done." I was like, "Go do that." And I was like, "Okay, it takes me no time to get done." And then he would not have anything else to tell me, and then he would just tell me, "Well, come in the first 3 positions in your class." And I came third. I'm like, "Why don't you just come second, and then we'll talk?" And I came second. And then, "Why don't you come first?" And I came first. And then he was kind of at the end of it, didn't know what else to tell me. So I got into trouble a lot. But I knew I wanted to do something big. And without much guidance, I gravitated towards computer science. I'm like, that sounds like an exciting field. Until one day, I got into a discussion with one of the prominent physicians. I'm not going to name the physician. And I asked him a very simple question. What is the role of antidiuretic hormone? This is something I'd studied extra because I was done with biology. I'm like, I just had some free time. I'm like, let's just learn something about the body. And he gave me an answer that was completely incorrect. And my father was there. A few other prominent people were there. And I corrected the physician. I was like, that is not correct. This is what it does. This is a purpose. And this is how it works. And so it's clear to the audience that I was right. And he was trying to defend himself. It just didn't get anywhere. And next day, my dad was like, "Son, have you thought about maybe becoming a doctor? You know, you're just so young, and you did that with that physician who was supposed to be very respected." And so that kind of got me into thinking about medicine. And so I asked my dad, I was like, "If you want me to be a doctor, I guess I can be a doctor. I can be whatever I want."
What age were you then?
I am.
No. At that stage?
At that stage, I was 14.
Okay.
I was 14, yeah. So, and then another thing happened. My youngest brother, Hamdan, was a victim of hit-and-run car accident by a drunk driver. And I remember literally I was the one who picked him up when he got hit. And I put my ear to his heart and it was pounding. And I thought, okay, well, his heart's working, you know. All I have to do is take him to the hospital. And I literally took him to the hospital. My cousin was there. We drove him to the hospital. And I laid him in the triage room. And I figured, you know, doctors will do their magic. You know, I've heard great stories, miracles happen, and so forth. So I didn't really think much of it. And I had some competition. I was involved in athletics, and I went for the competition and came back just to find out that nothing was done. And soon after that, he was brain dead, and then he passed away.
Oh, shit. Sorry to hear
So it just kind of got me into thinking that, you know, medicine may be advanced, but there are some things that are beyond your control. And these two events kind of culminated my passion in medicine, like true passion about making a difference.
That's powerful. Yeah, that is a motivator. And what age were you when Hamdan passed away? I was 13, I believe, at the time. So 13, 14 was transformational years for me, because prior to that, I was a rambunctious kid who just got into lots of trouble because I just had way too much time, and I would get done with things and I wouldn't have anything else to do. But it literally transformed me. I just had a very clear path about what's the purpose of life, you know, what should a person be doing, what's good, what's bad. And it was really bizarre that I would have conversations with a bunch of 30-year-olds. I could relate with them, and I just did not get along with my friends who were in school who were busy horsing around. Yeah. Wow. And then you go to the States. You went straight to the States when you finished school?
I was 18 and by myself, and it was an interesting journey. And I knew there was something about me that was just weird and off, and I knew that if I'm in an environment where I'm pushed, you know, very few people can stop me.
Brilliant.
And I was just in the ripe environment. I went to the States, and there were two areas where I just hung out outside of studying, outside of school. It was library and soccer. And when I was there, the university picked me up, and I'm like, dude, you play pretty good soccer. So I was center forward, lefty, and the university
You're a left footer?
team. Yes, I'm left
Interesting as well. Yeah. Okay.
Yeah. It was me and another Saudi friend of mine. We were labeled the fastest feet of the university because we knew how to dribble and we knew how to score, and the Americans could run, but they couldn't quite tackle, and we got that game real good.
And what university was this?
It was Murray State University. It was a university in Kentucky.
Okay. Interesting. When you were deciding, and the reason I was going to stay on this is because Destiny's in the decision-making moment of her life where she's trying to figure out which way to go. What drew your attention to Kentucky?
Actually, I didn't really know much about anything, and my dad was not educated. He had a friend who had a couple of sort of pamphlets, and one of them was this university. It was kind of random. I was like, okay, well, I guess I'm going to go there because you know this guy sent you this thing. And I was so naive at the stage because I didn't really think that there was much of a difference between universities.
Right.
And after getting there, then I realized universities are ranked. And then you should pursue a higher ranking school so you can get better education, better opportunities. So then my North Star became, okay, well, I need to go to the next level.
Right.
I need to, when I was there, I had plenty of people telling me, you can't become a doctor. You know, a lot of Americans who apply don't get into medical school. And not only are you not an American, you're not a white boy. I'm not saying that racism is rampant, but I've experienced my share of racism in the U.S. And a bunch of Saudi and Kuwaiti friends who were also in the university just kept saying, you can't. And I just have a tenacity in me that it's just whenever a person says you can't do it, I just have to go out of my way to prove them wrong. And I kept my studies. I was at the top, and I finished my undergrad and did the medical college admission test. I didn't score very high in my verbal because English is not my first language, but I didn't give up. I did the test again and again, and I got in. If you really look at the books and references about predictors of success, if you're a believer in the books, I shouldn't have made it to med school. I shouldn't have finished med school based on the numbers that they were quoting. But I'm here to tell all your followers and my followers that do not trust that. Mm-hmm. If you have self-belief, you can accomplish just about anything. I got into medical school, and I always had this fear because everybody warned me. U.S. med school is extremely hard, and it's very different from med school anywhere else, because in Ireland, if you want to go be a doctor, you can finish high school and start medical school. Mm-hmm. It doesn't work that way in the U.S. In the U.S., you have 4 years of undergrad that you have to perform. You have to have very high grades. You have to have extracurricular activities, research, and you have to score very high on MCAT. And even if you do that, you can get into medical school. There's no guarantee you'll finish medical school. It's very rigorous. So my Foundation of Medicine course, which is the first course in medical school, I was in survival mode because all I wanted to be is that MD mm-hmm. who is the last person graduating, but it's passed. That's all I cared about.
Yeah.
On Foundation of Medicine course, I had the top score in my medical school. That completely changed my perspective.
Wow.
I went from a gazelle's mentality to a lion's mentality, because I knew that I'm not in a survival mode. Mm-hmm. I can be dominant, and the rest was history. Then I just kept. So as far as my transcripts go in medical school, I have all A's except one B, and that one B is in psychiatry, because I suck in diagnosing depression and anxiety. So if you have that problem, don't come to me.
Yeah, fair enough. So what do you think then led you down the route of brain spinal surgery?
In medical school, the toughest section was neuroscience. It was the longest section, the most complex section, and everybody just struggled with it. I knew I wanted to be a surgeon of some type, and I didn't want to do any dirty surgery like gut, bowel, and foul-smelling thing. I wanted to do clean surgery. I had the highest score in the neuroscience section, which is the toughest section of all med school, and I wanted to do surgery, so it was a natural culmination. And yeah, the rest was history.
Yeah, because you've done some. We spoke briefly before, but even looking up your name online, you've done some pretty impressive spinal surgeries.
Yes. So yes, that journey. I did my internship at Cleveland Clinic, Ohio. I did my I did my residency in neurosurgery in University of Louisville. I did a complex spine fellowship within residency in University of Louisville, and I went to Johns Hopkins University to do my second fellowship in spine and peripheral nerve. Johns Hopkins University is world-renowned as one of the premier institution for neurosurgery, like number one mm-hmm. in the world. And so I felt like I had all the raw materials to just become who I am. And then I basically started my journey in neurosurgery. I then went into practice in North Dakota. I did the first ever robotic spine surgery in the state of North Dakota. I did it. It was, I believe, in 2019, and this was a level 1 trauma center, which is the highest ranking trauma center. You get all kinds of people coming in with all kinds of injuries, mm-hmm. and so I had a great experience in doing all these complex surgeries. And while I was there, I broke the world record for highest number of robotic spine surgeries done in 3 consecutive months.
Wow.
And as far as I know, I'm the record holder for that.
So what involvement does the robot have? Like, map that out.
So this is an interesting story. I have such high volume of cases that I was doing at that hospital that the company that who was supplying these screws and cages that I was using for these surgeries made this device, and so I just I asked them, would you mind just giving the robot to us for free? And I've got a strong reputation. It'd be free marketing for you. And they were like, well, it's a multi-million-dollar device. We can't just give it to you for free. And they talked to their bosses, And 3 months later, they actually said, we'll give it to you. So long as you're going to be the doctor, as long as you're here, the robot's here for you. And this was a brand new technology. Nobody was using it. There was only a handful of physicians in the U.S. who were trained to do robotic spine surgery amongst the neurosurgeons. And I basically started doing robotic spine surgery, and I did such a high volume that I basically broke the robot.
Oh.
And then they had to give me a
surgery.
second robot. So then I was like, well, because I had they had a lot of learning to do, because I had a lot of strong feedback about these are the issues that we were facing in the operating room. These are some things you could do different.
Yeah.
So we converted a non-reliable robot into a reliable Toyota of a robot to make sure that the robot keeps up with the surgeon and helping them with surgery. And the robot's role is not an independent role. It doesn't do the surgery. It does it with the guidance of the physician. And one of the types of procedures we do is putting screws in people's back. And the anatomy for those in some patients can be very tricky. And if you misplace a screw into a person's spinal cord, you could paralyze a person. And if you place it near a nerve, you could completely damage the nerve, and the patient may never walk normally or have abnormal pain and so forth. So robot helps in decreasing the error rate for these types of surgeries.
It's just a precision tool, is it? It's just
very precise. Exactly.
Yeah. So what kind of spinal injuries were you facing at that stage? Like, because you mentioned you saw so many patients flying to you. Is this long-term pain, or is this complex trauma, car crashes?
So both.
Yeah.
Both. When I was in North Dakota, we just had a lot of trauma. Patients getting into wrecks, and patients getting into wrecks from 4 hours away. They would be flying from those to, and I just had a very high volume of these complex cases. And then when I came to Texas, that's when I think word got out to some high-profile people in Abu Dhabi about me. And so they sent me a report of a child with a brain tumor that they wanted my opinion. So I told them, if the child doesn't get operated on immediately, she will be dead. So they were shocked with that response, and basically told me, well, there is no surgeon in the country willing to tackle this case because of its complexity and the risk involved. So they asked me to talk to the physician, and I basically coached him through, saying, I know you don't want to do the surgery. How about you this particular technique? It's going to take the pressure off this brain. At least you'll give this child a chance to live. He said, great idea. I didn't think of that. I'm like, great, go talk to the dad. And then talk to the dad. Dad was like, you're not going to touch my daughter.
Okay.
We need this American trained physician to come. And Sheikh Mansour, its team, basically sent a private jet to me in Dallas, and I canceled my entire clinic and OR for 2 weeks. And after I was done with the clinic, I went to Dallas directly. Dallas, New York, Geneva to Abu Dhabi Presidential Airport called Bateen. Landed at 2 o'clock in the morning, went directly to the hospital, did the surgery. It took us 4 hours. We took the entire brain tumor out, saved this girl's life. That's when the folks knew, hey, he's one of us. He's in the U.S. Doing great work. And then they asked me, what else can you do to serve this country or to put us on the map in the region? And I said, one of the easiest things I can do is robotic spine surgery. I've been doing it for a while, and nobody's done that here. Get me a robot, and we can get going. So they bought the robot. I had an American team and European team coordinate for getting my support staff with me in the OR. We did the first ever robotic spine surgery in the Middle East and Africa. We did it 2 years ago in Abu Dhabi.
Successful?
Yes, successful. Patient's pain all went away, and he was very happy with the result.
Yeah, amazing. So when you talk about spinal surgery, you're talking both skeletal and spinal cord.
Yes.
Obviously, people are familiar though with spinal cord trauma leading to paraplegia, quadriplegia. How far are we away from people being able to walk again?
Oh my God. If you look at my profile, I have a lot of patients, true patient testimonials. By the way, I've never paid anybody to do any. It's true patients who have been paralyzed completely, complete paralysis, paraplegia, quadriplegia. Paraplegia is complete loss of function in the legs, and quadriplegia is arms and legs both, who have come back. One thing everybody needs to understand is not all paraplegia or quadriplegia are permanent.
Okay.
And if you get that condition, and if you get prompt treatment by a reputable physician who understands complex surgery of this type in a center that has the tools needed to do the surgery, your chances of recovery can be extremely high, because it requires swift intervention, quality surgery done at a reputable institution with the tools, with rehab facility. The outcomes can be dramatic. Just recently, 2 months ago, they had a news about my patient who was in his 20s, basically completely paralyzed from his legs from a car accident, and I saw him in the clinic, in the ER, and I really felt bad. And I was like, wow, you're in your 20s, you can't move your legs, and the chances of you controlling your bowel and bladder function for the rest of your life is very low. So I told him I'm going to do the best I can, and lo and behold, he came to my clinic, for his 2 weeks check, completely normal with his mother, and he was extremely happy and grateful for the result.
Did you say in 2 weeks or just a 2 week check?
In 2 weeks.
Wow.
Absolutely. He came to me, and I actually posted a video on that on my Instagram, and with his mother, and they were just extremely grateful.
Because growing up, we always knew, Christopher Reeves is the famous Superman case where he broke his neck and spent the rest of his life in a wheelchair. So what was the change? What was the moment where medicine went, you know what, now we can do it?
So it's not the case for all spinal cord injury. So it just depends on the severity. Some people's spinal cord gets so damaged that there's no end in sight for them. And for those people, still, I think there is some hope with stem cell therapy and with use of other technologies like spinal cord stimulation, that they can potentially have improvement. We're not quite at the stage where we can say if you have a severe spinal cord injury and you've had the surgery done by a prominent person in a swift manner, for them to completely be normal, we're not there yet. But there are interventions that have really shown positive change. In 2011, I did the first ever spinal cord stimulator placement along with the chairman of neurosurgery in University of Louisville. His name is Robbie Summers. He was all over the news. He was paraplegic. He had a neck injury. He actually walked, which was mind-boggling for us, because we never thought we could.
2011 as well.
We can do something like that, and we did the same surgery on a second patient. We did not get that result.
Right.
So that tells you that there's variability in people's responsiveness for technology. And there was a recent study done in the U.S. Where they used stem cell. They actually harvested stem cell from the patient himself, from their fat, and then they basically used the stem cell to multiply in a certain number, and then they gave it intrathecal. They would join the stem cell within the spinal fluid of these patients, and 70% of them got better.
Wow.
So I think and there's research that's being done to place chips below the site of injury that can communicate directly with the brain, that can allow people to walk. I hold a patent in brain-computer interface with the use of exoskeleton to allow for patients who are paralyzed to walk, because the brain-computer interface technology has become fairly robust. With you simply wanting to stand up, you can communicate that to an exoskeleton for it to stand up and walk. So there's a lot of promise in the field, and I think I'm hoping within the next 5-10 years we'll have some robust treatment options for patients who suffer from spinal cord injury and paralysis.
No, it's devastating. I kind of mentioned beforehand, Chris and I have a friend who, shortly after we left Dubai, he broke his neck playing rugby, and we went to visit him. And back then he was doing good. He's still working away. He's still getting on with his life. He's making the best of it. He's in the UK, but it's just crazy to watch it happen to someone that you know, someone that you care about. You know their life beforehand, and then the quality of life after is extremely different. I've kind of been keeping an ear out to this part of the medical world with him solely in mind, that hopefully someday he can get the right treatment. He's in the sport injury rehab world in a clinic, so he's not too distant away from the injury or the industry. So I'm hoping when things come at that level, he's a good candidate for it. But so how does it work? Let's take it right back to the moment of injury. You're looking at something traumatic where the spinal cord is severed, so there's now no communication between sections.
So that's a severe injury.
Okay,
so
that's
cases,
severe, yeah.
These cases are extremely rare. The spinal cord itself is severed. There are cases, but extremely rare.
Okay.
Most cases are you have spinal cord injury.
Mm-hmm.
Either the fracture fragment. So if this is a spinal cord,
Mm-hmm.
the bone has basically shifted right into the spinal cord. It's crushed.
Yeah.
So when you have an injury like this, where the spinal cord is still contiguous or is continuous, there's no transection of the spinal cord, the best thing you can do in this setting is basically find a way to give the spinal cord as much room as possible.
Yeah.
So to remove the major portion of the spinal cord compression is from the front of the spine, which is very difficult to do from the back. It's highly risky. So taking the pressure from the back is easy because you can feel your backbone. You can just take that pressure off, but that's not enough. You have to go from the back to the front and push that bone away from the spinal cord. That's risky. A procedure called transpedicular corpectomy, reconstruction of the spinal cord. These are the cases that I've done quite a bit of, and with high degree of success. And now that you remove the bone there, there is nothing there to support the spine. So it's almost like having
so you have to remove it, like as in
completely,
gone.
just drill it out completely. There's nothing, because you should not have anything touching the spinal cord at this stage, because the spinal cord now has been hit.
Yeah.
And the next thing you know, it's going to start getting inflamed. It's going to swell, and you need as much room. You need to give that spinal cord as much room as possible to expand, to allow for the connections of the nerves that has been disrupted to potentially heal again, because there's a decent chance it could heal.
And is all of this time sensitive?
It is extremely time sensitive. The sooner you do it, the better it is.
Yeah.
So you can do a perfect surgery, 5 days later, get terrible result.
Right.
You can do an 80% good surgery and get amazing result if you do it in the right time. And then you have to basically, it's like a 5-story building. You've now taken the 3rd story out. What do? You
gotta rebuild
you have
it.
to go basically from the back, create a cage, expand the cage, and give it a metallic support from bone to bone. It's like basically reconstructing the spine and making the person bionic, and then put screws above, screws below, rods to stabilize the structure, and then wait and see what the patient does. And for vast majority of the patients that I've seen, when I'm on call, I get them taken care of with a high degree of success. Patients get better.
So you've mentioned stem cells a couple of times a few minutes ago. Do you also utilize stem cells in this procedure as well? Like, does it help the rebuilding of this 5-story building?
So no, not for this particular part. Stem cell is relatively new in availability. It is not an FDA-approved treatment. The only FDA-approved role for stem cell is for treatment of certain types of cancers, blood-related cancers that are official. And as far as I know, nowhere in the world is it stem cell an approved treatment. But there are lots of trials that are being made with stem cell and with promising results. It's used in basically when when we age, our disc height goes from this to this because it dries up. And with the studies that have been done for stem cell injection into the disc itself, it actually regains the height. It almost makes you go backwards in aging, which is amazing.
That's incredible, yeah.
I've not, I never in a million years as a physician, as a surgeon, neurosurgeon, thought that this could be possible, but this is reality. And they've compared studies where patients who undergo surgery versus stem cell therapy, their results were very similar without the major risk of surgery. Stem cells also being used for injury rehab. If you have a shoulder injury, a knee injury, an elbow injury or ankle injury, and with with stem cell and other non-invasive treatment options, patients make a dramatic comeback. Now the results are not the same for everybody, and some people get a very strong response. They're called super responders, and others may not get any response at all. But to have an option like that available is a great option, especially for patients who may not benefit from surgery.
So how does it work? Because we when we envision surgery, we kind of think knives, tools, physical, you can see what's happening. But we're talking at the cellular level with stem cells. So like, what is in my mind, and you can tell me how right or wrong or where I'm completely missing it, I'm imagining it's some sort of like cellular scaffolding that goes into the tissue, and then the correct tissue builds around it, and it restores the way it should be.
So the best way to explain this is, so when we're formed as children, it's like an embryo, and an embryo has these 3 distinct layers, and then each layer decides to become skin, nerve, or it's going to become the internal organs and so forth. And it's all based on cell signaling. And at an early phase, there are some generic cells that can be anything.
Okay. And
then they choose to become what they need to become based on signaling of the cells. So when you've isolated stem cells, these cells are like baby cells. There's great research being done on patients who've got burn injuries or skin for use of stem cells. So these cells are generic cells, and then when you go put them in an area where there has been an injury, or the cells that have been injured, interestingly enough, are now being replaced by these healthy young stem cells that are destined now to become skin cells because of the signaling they get from the cells around that area. By the same token, cartilage, by the same token, the inside of the disc, you basically have given them, these are generic baby cells, and now they're hanging out with other cells in the nucleus pulposus, which is the center of the disc. It starts assuming the role of the injured cells, and now the injured cells that are resulted in loss of height of the disc, all of a sudden you have sort of normalized disc space. So I think it's very promising as to what all this can be used. I'm about to get into an affiliation with one of the prominent institutions in Dallas that is offering stem cell. We're in the initial stages of getting institution review board approval and okay from FDA to be a trial center, and to get a Department of Defense contract to basically start offering stem cells for patients who are in the military who've suffered traumatic brain injury, amongst other injuries, to see if they can benefit from this technology.
So when you get to the brain, I kind of lose my anatomical knowledge. So I'm a bit more musculoskeletal. I do know nervous system, but the brain is sort of, how that works is completely beyond my understanding. So going back to, if you look at your cartilage in your knee, we put a bit of stem cells in there. It communicates with the neighboring cartilage cells, and it signals it. How does it know when to stop? Like, why doesn't it just keep? Are you controlling the dosage? Is it simple as that?
No. Great question, by the way. I'm sure a lot of people have the same questions. I can give a fairly detailed answer for this. So you have to know that most cells have internal parameters for signal transduction. It'll say, hey, these are your limits. You can grow to become this, and that's that. If you lose that control, then that cell becomes cancerous. Then that converts into, that's why it's a strong contraindication for using stem cell in a setting for cancer, other than using it for primary treatment for blood-related cancers like leukemia and lymphomas. I would never even entertain that possibility of using it in a patient who has either prior cancer or is actively in malignancy. So
because you're worried about it just going too wild,
going out of control. Because now you're trying to replace the bad cells with normal cells with these stem cells, but then these stem cells can now hang out with the wrong crowd, like cancer cells, and start assuming the role for cancer, and then it's going to boost the cancer to basically get everywhere, because that's a true, a big no-no. By the same token, the role for the brain involvement compared to musculoskeletal, musculoskeletal, if you were to give an injection somewhere, or even give an IV, it can go to wherever the blood goes to. But in brain, there's a specific protection that the brain has that other organs don't. It's called blood-brain barrier. So let's say you get pneumonia, you get blood in all over you, bacteria in your blood all over. It's not going to get into the brain because of that protection, because that's God's way to make sure that the central processing unit is under control, because that doesn't get. So by the same token, if you have to use stem cell therapy, giving it through the IV and expecting it to get to the brain is not a very smart way to think, because it may get some cells, but the significant portion of it is not going to get to the brain because of the blood-brain barrier. For the same reason, for the patients who had the spinal cord injury, they actually got the injection through the spinal fluid that basically communicates with the brain and the spine. So the area of injury gets the highest dose of these cells for rehab. So that's the big distinction. The cancer cells become cancer, but most cells where you don't have cancer, there are signal transduction. There are control systems in place that once the stem cells choose to become a particular type of bone cells, skin cells, they'll stop, just like a normal cell would. But for the brain, blood-brain barrier has to be overcome if you want the dose to go to the brain for a brain injury or a brain disease.
So in situations, say you have, does the person need to use their own stem cells from their own system, or there's external sources? Because there's a lot of different information out there in the ether about which.
Sure. So there is pros and cons for each. So there are primarily three sources for stem cells. If you look at it in a big picture, one is the adipose tissue, which is the fat cells that you have. You can harvest it. There's a specific pathway you go through to get the stem cells, and you put it in the lab. You basically allow it to grow in a certain number of cells, and then you decide to go treat it. Second is you can get stem cells from your bone marrow. You've probably heard of bone marrow transplants in cancer. And then third, so first two are your cells. So you'd get to harvest it from you, use it on you. And the quality of cells you get from you is as old as you are.
Right.
So if you're an 80-year-old who wants to do a fancy stem cell treatment, your stem cells are 80-year-old stem cells. It's like buying a 1990 Mustang, and you've done a lot of donuts in the Mustang. You put a couple 100,000 miles in the Mustang, and now you decide to race it with a 2024 Mustang. It doesn't stand a chance. The third category is called. The first one is autologous. The third example is an allogenic, which means it's not coming from the patient himself. And for that, vast majority of studies are being done on umbilical cord derived, stem cells. And for those, patients sometimes specifically want that because they want to get that young stem cell because the stem cells that they have of their own may not be of the same responsiveness. So again, a lot of research needs to be done about effectiveness of each one of these categories and for what specific treatment. That's why it's not FDA approved.
It's not FDA approved because we haven't got to that amount of time has passed?
Yes.
Okay.
But there is a law that was passed, I think in 2018 or 2019 in the U.S. where you have the right to treatment. You as a patient, you could have a terminal condition where there is nothing else available for treatment, and you'd want to try stem cell and to see if that makes you better. And that's where patients with Alzheimer's or Parkinson's and some other terminal conditions where, like, I know it's not approved, but I'd rather get some treatment versus just die a miserable death, that slow death. So patients end up participating in these.
And for Alzheimer's and Parkinson's, it's just that same principle. It's just young cells going in, replacing the old.
Basically, it's in that case, typically it's not your own, but you can choose to get your own cells. They typically use other younger cell population, and from these labs that are in the U.S., they have basic lineages of cells that have been harvested young, and they are proliferating, and they have a decent quantity of them. You can buy a certain amount and inject it where it's needed.
So that's what I was going to ask you next. But when you were talking about the umbilical cord stem cells, is there a market, or is it a done thing where babies who are born now taking their own umbilical cord, freezing it somewhere for the future usage, so that baby will grow up into an adult and then have their own umbilical?
Yes, that's completely doable. I think that's you can use that model and a lot of people are actually now doing that because of that technology.
Wow.
It's available. There's some costs associated with it for storing that placenta and then processing the umbilical cord for getting the refined stem cells from.
So in that way you could have your own, but you're also just saying that there is effectively storage units that have
available stem cell
taking it out. Yeah,
because the one big concern that a lot of people have is like, well, why would I take somebody else's stem cell and put it in my body? What if I have a reaction? Interestingly enough, the incidence of having a cross reaction with stem cells is extremely low. There is something called HLA compatibility, or there's each adult cell that we have in our body has a little marker on it. It says it's Keith's cell, or it says it's Dr. Abdul Salam's cell. But when you're in the stem cell zone, that marker is missing.
Okay.
So it's almost like you can cross it between different people.
Naturally missing.
It's naturally missing, yeah. That's why the incidence of cross-reaction from stem cell is extremely low. I mean, I don't want to say zero. I'm sure somewhere something like that has happened, but based on the studies I've reviewed, very, very low, especially when I reviewed the data on the stem cell for the stem cell that's been used for disc and patients who have back pain. They don't want surgery, they just want to have it available for their disc. It was great result.
So it's just simply not a widespread common practice, more to do with the FDA. It hasn't got through FDA approval because we haven't seen the long-term results of these.
Yes, and if something is FDA approved, you also need to know that the insurances have to start covering. So I don't know the politics of it, but I'm sure there's a role there, because if something's FDA approved, it's going to be very expensive, and insurance companies will try to fight tooth and nail to offer that, because they're in the business of making money from patients, not in the business of giving expensive treatment to patients, especially if the treatment option is more cosmetic, I would say. I hate using the term cosmetic because it's actually it actually physically makes a person better. Like if you were to give a patient who has lost all disc height and is having a lot of back pain and doesn't have any nerve compression, cannot benefit from a surgery. If you do this, and it can potentially regain the height of the disc, and then patient can have fairly normal function, that's a very rewarding procedure. But their argument would be like, well, there is no nerve compression. Why would you want to offer that? Or disc height, well, that's just a part of aging. Why don't you just let people age normally? But now people are fighting back. People don't want to age. People want to feel young. They want to look young. They want to live a long life and a productive life. They don't want to change their activity. So that is an option available, but there's going to be a lot of political fighting from the insurance companies because of the cost associated with stem cell, because it's very expensive.
Yeah. And where does that also play into the ethical discussion about it?
Good question. I mean, I think there's, depending on your upbringing and what you believe, I think one of the sources for stem cell that we haven't talked about is stored embryos. So patients who suffer from, conditions that prevent them from having kids oftentimes resort to physicians who provide in vitro fertilization or other methods of reproducibility. Then what happens in a lot of these instances is patients are they get the number of kids that they want, but they have a few other laying around. I never use that.
So people are using those for stem cells.
So some people may choose to use that. I never use. I don't feel good about it. I would never use that. I'm not an ethicist, but something just feels wrong about an embryo that has been given life and now is being processed to harvest the stem cells from it. So that is one component that I forgot to mention. But that's not even on my radar at all. And even if it's approved by any institution, I doubt that I would ever use that, just because of my moral upbringing.
Yeah. That's the hinge point, is it, for the ethics, or is there more to it?
So that's that. And then this other is like, well, you're getting cells from another individual. And is it okay to put it in your body? In the U.S., we have a sect of Christianity called Jehovah's Witness, where they will not accept.
Yeah, they don't accept organs as well.
Not organs, and not even blood transfusions. So if you were to bleed to death or whatever, and then there is something that we can do to bring you back, you just don't want to get the blood, and you'd rather die. So there is that, strict religious interpretation of getting blood products or other cellular products from another human being. Again, I'm not an ethicist. I'm not a religious figure to be qualified to give an opinion on that, but that is an issue that comes up. Me personally, I think if it's coming from another healthy individuals that is vetted and clean, then make sure that there's no infectious source, and if it can help improve my function and benefit me, I personally don't have a problem getting something from another individual, so long as it's not from an embryo.
Yeah. Okay. So where is all this going? Like, what's the cutting edge stuff? What are you excited about with this?
I think all of this, and there are different products that are being made from cells. There is also something called exosomes. There is acellular forms where you can have dry forms of it that allows in helping boost your extracellular matrix, which is the cushion of a lot of the cells to keep it to give its structural integrity. And there's other related products, but these two are kind of the main ones that people talk about or use. But I think we're learning a lot, and patients. I had a gentleman who came who was limping in my office, who needed a knee replacement. I could barely walk and got stem cell therapy. Literally 2 days later, called my office and said, "Can I go running?"
Wow.
And I said, "Absolutely not," because you're walking, you're pain-free, and that's a blessing.
Yeah.
And you should not push it, because typically you'd want several weeks for the cells to integrate before you start challenging them. And another gentleman who had pain in his shoulder and his back and his knees and got the therapy, came back 6 weeks later with zero pain. So I think it's very promising, and we're learning more, and I'm trying to educate my patients as much as possible to discuss that it's not FDA approved, to discuss the risks and benefits, and have a thorough sit down with the patients about the good benefits of this and potential downside of this, so that patients are well informed about their decisions.
And FDA is firmly US based, and people do take their kind of inspiration and their lead from what the FDA do. But how is it in the rest of the world? Like, I
don't know actually, and there are also sort of off-label use of therapy. So back in the days, when we were doing spinal surgery in the back of the neck and we were using these instruments, we've been using them for 30, 40 years, but they're not FDA approved. That doesn't mean it's bad. It just means that the FDA just didn't go through the process of approving. Maybe they've approved now. And physicians also use their judgment in providing care that they think is fair and safe to the patient. So, and there's lots of medications that are off-label use that can benefit the patient. But I'm sure there's a European body that's equivalent to FDA. Just my entire education was in the U.S., so I can tell you all about the U.S. healthcare and how things work there, but couldn't speak about the European side.
I mean, from just being an internet rabbit hole diver on YouTube and stuff, you hear a lot about China doing their thing with stem cells and lots of question marks here and in other countries. If you want this done, you can't get it done here, but you may be able to get it done if you fly this part of the world. So it's interesting. Where do you see it? Like, do you see it becoming FDA approved? Do you see it becoming
honestly, I think as an Emirati physician, as a neurosurgeon, I want to bring that technology here in the UAE. I've had some royal families contact me from very, very well-to-do countries, without naming names, wanting this treatment, specifically by me in the U.S. And this country is an amazing country. I mean, from the time I left this country and now, it has blossomed into this cosmopolitan, highly coveted place to live, to enjoy life, to seek medical treatment. And we've come a long ways, and UAE has been reshaped into a mecca for prime area to live your life and to even retire, and to also attract a lot of people from around the world to seek medical care here, to make this a medical tourism hub. And I want to put my stamp on that venture, and I really want to make that happen here. All these cutting edge treatments that I'm doing in the US, I want to be able to offer that here in UAE, serve the Emiratis and the local residents and potentially everybody else who wants to come to get their treatment here in UAE.
So what does that look like to go from this afternoon to that happening? Does the law have to change? You obviously need a lot of funding. Like, what would the journey there look like?
I think, first off, I would need some support from a very high level. Preferably leadership of the country, and they've always welcomed Emiratis to get into that arena. I have to just make connection with them to get that support. Once you get that support, then we can first immediately start off with things that are legal, which is your stem cells on you. That's legal. I mean, we can definitely get that ball rolling immediately, and for that to happen, I think you're looking at a journey of 6 months to a year to make that to become reality. So long as you have the funding, you have then I would be given the authority to kind of spearhead this project. And you don't know me well, but I go 100 miles an hour.
Wow, yeah,
I don't slow down. Yeah. So once something is given to me, I go running and I make that a reality. And to make all these different ventures that I'm in practice in the US to make it happen here, you're looking at a project of around 3 years, maybe 5 years, because certainly every hospital that I've worked at, I've converted that hospital into a spine center of excellence. Like literally every hospital, and I can do that here. I mean, I'm the same guy, just in a different country.
Yeah,
in my own country.
Just in your home country. Yeah.
Yeah, and my home country would give me all the support I would need to make that happen, because it'll only boost its presence both in the area and internationally for being a leader in this field.
Well, I wish you the very best of luck with it. It'll be quite a legacy to be able to make all that happen. So whenever you're back in town, we can catch up again. Where can people follow you online and follow your stuff and get your information?
Well, I have 2 separate Instagram accounts, and we'll probably put that in the tag. That one is an Emirati one for my Arab followers, Dr. Abdul Salam Belushi, and the second one is the American one. That's both a verified account, and the American one is dr.abdulbaker, and my website is Dr. Baker Neurosurgery, drbaker_neurosurgery.com, and certainly my I have Snap, and I have my phone number in the US 469-94-SPINE. Happy to help anybody get more information, or if they want treatment, happy to help them any way I can.
That's it. That's where people, if you want treatment, if you want a consult, reach out. Thank you so much for your time. I know you're very, very busy, so I want to be respectful of that. We'll let you go. Thank you, guys.